The Society of Midwives of South Africa, that's SOMSA, says it's time to act to reduce maternal and infant death. SOMSA is hosting its annual congress in the Free State, bringing together 250 midwives, healthcare professionals, educators, researchers and policymakers to advance maternal and newborn health. The focus will be on addressing the shortage of midwives, which has been identified as critical by the World Health Organization. SABC News reporter Kamogelo Seekoei has more.
The discussions here at the President Hotel, where the Society of Midwives of South Africa is hosting its Congress, are essentially how the profession can be strengthened. We heard already from the chairperson of the Congress opening the gathering earlier today, talking about how some of the midwives are actually leaving the country and calling on the Department of Health and other stakeholders in this particular profession to actually strengthen the training of midwives. They're talking about the critical shortage that this profession is experiencing in terms of the ratio of patient to midwife. Although the stats are not really clear, because what she explained to us is that they don't really keep records as other countries, but there is a call for at least 1 million more midwives globally. I just want to bring in the chairperson of the society, Rebecca Motete, just to talk to us about some of the discussions that are going to be taking place. I know that the Congress is taking place over a period of 3 days, and today you just opened the Congress. Talk to us about some of those discussions that are going to take place in addressing the critical shortage of midwives.
Some of the discussions that we are going to talk about, it's 1 million more midwives saving mothers and babies. Because if we have enough workforce on the ground, definitely mothers and babies are going to be safe. The other one is to push towards 1 million more midwives, where we are going to ask each other as associations and stakeholders collaboratively difficult questions on what is it that we need to do to improve more midwives in the country, like the education, the labor movement, how are we going to prevent the brain drain, and also we are also going to talk about the respectful maternity care. Recently there's a report that was shared on the 11th of March in Johannesburg, where an organization that is called Embrace did a research in KwaZulu-Natal and Gauteng, and the evidence showed that there is obstetric violence that is still continuing. Obstetric violence is when women are not treated properly in our labor wards. We cannot put that report under the table. We need to share it. So we are going to talk about it, and also there is a pledge that we are going to sign as the department, as the midwives, to say we are pledging for respectful maternity care.
Now, talk to us about the ratio. I think this is one of the areas of impact when it comes to childbirth. You mentioned that there is an imbalance. Just talk to us about what is the status in the country.
The status in the country, I'm going to start with what needs to happen. The guideline is 2 births must be attended by 1 midwife, but currently we don't. So 1 midwife is caring for 5 women in labor. So that is the situation that is happening. But we keep on pushing for safe births amidst the circumstances. Yes.
Thank you so much for your time this morning. That was the chairperson for the Society of Midwives of South Africa, Rebecca Motete, just talking to us about that very important topic of midwives in the country. Of course, having a shortage will mean that there is a lot of impact when it comes to childbirth in the country, but these are some of the discussions that they will be having over the next coming 3 days.